Hi, my name is Patrick Hayes. I'm an orthopedic surgeon that works at Cleveland Regional Medical Center. I'm fellowship trained in shoulder surgery, got advanced training in shoulder reconstruction at Mount Sinai in New York City, following my fellowship at Chapel Hill for orthopedics. Today I'd like to tell you about some of the exciting things we're doing at Cleveland Regional with respect to shoulder reconstruction and shoulder repair. The state of the art of shoulder reconstruction at Cleveland Regional Medical Center is as advanced as you'll find anywhere in the state. I don't think you can get a better rotator cuff repair anywhere. And the reason for that is multifactorial, but it all starts really with the anesthesia. And I'm proud to say that Dr. McCullough and Dr. Clifton, as well as their partners, have kind of led the way on this to offer new and improved regional anesthesia to the shoulder prior to having your shoulder surgery at Cleveland Regional. What that means to the patient is that they'll be offered a shot in their neck prior to the operation, which can make their arm numb after surgery up to 18 or 20 hours and alleviate a lot of that immediate postoperative pain. What we found when we do an operation with this technique is that the patients actually experience less pain. They experience less severe pain because they never get to that really high area of bad pain right after surgery with the block in place. They take less pain medicine than those that don't get the block, and they recover faster. So it's really a great thing for the patients. In fact, McCullough has pushed the envelope even further by offering in select patients where it's necessary to do the operation solely with the regional anesthesia. That means they don't even get put to sleep. They don't get a breathing tube down the throat, so they have less sore throat after the operation. They recover quicker because they haven't had as many medicines in their vein during the operation, and they can still go home that day. So that's a good advantage for the select patient that's either too fearful of the surgery for the fear of being put to sleep, or if they have a very bad heart and it would be a danger to their heart to be put completely asleep. We can now do the same operation just under regional with some medicine to keep them relaxed during surgery, but breathing on their own. So those are exciting advances that really bring the state of the art and the cutting edge really to Cleveland Regional Medical Center. And kudos to the anesthesia department for providing that for us. And there's a lot of patients out there who either feel like or have been told by their providers that they can't be put to sleep. And part of that may be due to having a bad heart. If you have a terribly painful shoulder that's debilitating, you're a little bit painted into a corner. I mean, you can't get it fixed because of your heart, but you can't live the way you are because of your shoulder. So just a couple weeks back, we operated on just a patient like that. Dr. McCullough was able to provide just regional anesthesia for that patient. And he went through the operation beautifully, got a great repair, and went home the same day without any complications with his heart. I think it does open up for that select patient who is either very fearful of being put to sleep, who has been told by his cardiologist or his regular doctor that they can't be put to sleep for cardiac reasons. It opens up that as a solution potentially. The nurses in the recovery room will tell you that a patient who's had a complex open reconstruction to the shoulder and hasn't had the block typically has some pretty significant pain right after surgery. Having had the block, they're a lot more comfortable. They require less medicine in the recovery room, and they can often go home the same day, even if it's an open procedure. Even if we're able to accomplish this shoulder surgery through tiny pocos, like with the arthroscope, it's still surgery, and it can hurt, certainly. I will tell you this, my patients that have had arthroscopic reconstruction and the block often are taking only Tylenol or Motrin for pain relief just a few days after the operation. So I think blocking the shoulder at the time of surgery and limiting that severe pain right after surgery, keeping them comfortable for the first 18 to 20 hours. There's good data to show in the anesthesia research literature that if you never reach those peaks, then your pain in general, even weeks after the surgery, is lower. So I think it's a great thing, and I'm really thankful to the anesthesia department for bringing it to CRMC.